So I see that people are joining now. The numbers are climbing. We're in the 40s now and still climbing. So just as people are joining, I'm delighted to introduce myself and other colleagues here. I'm Timmy Frawley. I'm a member of the UCD Neurodiversity Working Group. I'm delighted to be joined by Mr. Ken Kilbride, the CEO of ADHD Ireland, and also a member of our group here in UCD. Ms. Dawn Slattery as well joins us from the College of Health and Agricultural Sciences. And we are especially pleased to be joined by our guest speaker for this evening, who is Professor Amanda Kirby. And Professor Kirby is going to speak about developmental coordination disorder. And just prior to joining, I was reflecting on my favorite aspect, I think, of the series is the fact that there seems to be some really significant and prominent international speakers, but also there's great depth and variety, I believe, of topics covered. So just in terms of background, Professor Kirby is an emeritus professor at the University of South Wales and an honorary professor at Cardiff University. She has clinical and research experience and has founded and ran a transdisciplinary clinical and research team for 20 years relating to neurodiversity. She has written 9 books and more than 100 research papers in the field, and her latest book was published in 2021, Neurodiversity at Work, Drive Innovation, Performance and Productivity with a Neurodiverse Workforce. She's a qualified GP and has a PhD relating to emerging adulthood and neurodiversity. She is the chair of the ADHD Foundation and works closely with many other charities working in this area. She has worked in the justice sector for more than 15 years. She is the Chief Executive Officer of Do It Solutions, a tech for good company that has developed biopsychosocial accessible tools to support people in and out of the justice sector. So a very focused CV there, I would say, but also rich with different areas that I hadn't fully realized myself. So delighted to have you on board, Professor Kirby, and thank you for speaking to us this evening.
Thank you. Well, good evening, everybody, and thank you for coming along to listen to me this evening. I'm going to take you on a sort of roller coaster ride of DCD in the next half hour to give you an understanding of what it is, how it impacts on children and adults, and what I think are the key elements that we need to be thinking about in supporting children and adults. And then I will stop and take questions from you, and you can ask me anything, really. Okay, so let's get going. You can see my screen, is that okay? Can you see my screen? Yeah, good. Okay, so what's developmental coordination all about? I'm going to tell you a little bit about it, the definitions, how it fits in with other neurodivergent conditions, and really it's really important we think about the whole person, because often we slice people into, are you this or are you that? And I want to talk about DCD, but in the context of a person, because that's actually, nobody is DCD. There are a lot of other things as well. So let's start off with that sort of definition. There are international classification of definitions in the World Health Organization, DSM-5. There's also the ICD-11, the WHO, so the American Psychiatric and WHO definitions. But a few years ago, we got together with health, education, a number of different professionals coming from different parts and said, let's have a definition that people can understand. What does it mean? And often people use the term dyspraxia interchangeably with DCD. Probably haven't got time to go into why that's not quite right, but I live with that. And so we do sometimes, and I think it's probably partly because we can't be DCD-ic, but we can be dyspraxic. And so that's why people use that term more than others. So what's this? This is a sort of starting point for the definition. It's a common disorder affecting movement and coordination in children, young people and adults. So this is important, okay? About 3 to 5% of individuals have dyspraxia or DCD. So it's common, it's far more common than autism, for example. Developmental coordination disorder, developmental, you're born with it. Coordination, you've got to have the coordination bit, that's really important. and then the disorder because it's impacting on somebody's lives. It's different from cerebral palsy and stroke, okay? So that's really important as well. So it's not due to other motor challenges that somebody might have in child or adulthood. It occurs across the range of intellectual abilities. It's not, we don't use terms like high functioning and low functioning. It's across all cognitive abilities. It's a lifelong condition, and I think we need to be thinking about DCD as we need to about other conditions like ADHD, a bit like diabetes. It's something you have, it's something you don't grow out of, and it's something that can affect you in multiple ways, physically and psychologically, and have an impact. So it's lifelong. You don't grow out of it, but I'm going to give you lots of strategies to say, how do we live with it? And I got into all of this, just for a pause for a second, because I'm the parent of children and grandchildren who are neurodivergent, and my son was diagnosed at 3 with developmental coordination disorder, and he's 30 plus. I can never remember how old they are, my kids. But at that stage, we were told that he would grow out of it, because 30 plus years ago, people had no idea about adults and DCD. So it shows how far we've come. So the main thing about the diagnosis is the person's coordination challenges will affect their functioning. So if you think about getting up this morning to going to bed tonight, just think about what doesn't require coordination. When you get up, you dress, you clean your teeth, you're using knife, fork, you're sitting on a chair, whatever you're doing, that requires coordination, okay? So I think someone's asking for a transcript. I'll put on closed captions at the bottom. I don't know if it'll work or not, but I'll put it on. So differences in how the person learns those new skills at home, education, it means that somebody learning new skills often takes longer to become, to be able to, sorry, I don't know if somebody else wants to put the closed captions on, it doesn't seem to be capturing it. So it means people need more practice to automate some of their skills. Difficulties may vary in their presentation. And these might, over time, it might depend on the environmental demands. So I'm just seeing that somebody's asking about low transcription. There we go, it's been enabled. Okay, so I think this is important. You have coordination difficulties, they impact on your day-to-day function, but your environment might mean that you have more challenges than not. So if I've got handwriting difficulties, I've got access to a computer, I don't have handwriting difficulties because I can record in another way. And that's really important to think about. Although motor difficulties, the coordination, the motor difficulties are really important, it's the non-motor that often continue to be impact as you have increasing demands. And the non-motor, which we call executive functioning, planning, organization, and time management, for instance, are very impactful because demands go up. You have to be more independent, you have to do more planning. And so this often is the biggest challenge for adults with DCD. And then there are co-occurring motor difficulties, non-motor difficulties, which I'm going to talk about, that coexist with DCD, and that is social and emotional challenges. If you can't kick a ball and you can't play games and other kids are doing that, you get left out socially. So you can't engage so well. And so when everybody else is getting more practice, you're getting less practice. Things like time management and planning and personal organization, getting going, getting to a place on time. But I think what's really important with appropriate recognition, reasonable adjustments and support, people with DCD can have very successful lives. And my son is married with a baby. He's on holiday at the moment. He's in a full-time job. He's uber super brilliant, but he had severe DCD, significant DCD, and that hasn't gone away. His handwriting is still not so good today as it was as a child, but he's found ways to get around some of the areas which I'll talk about. Okay, so we've got about 3 to 5% of the population. Severity of motor coordination is on a continuum. It's not like either or. We think it's about 2 to 1 boys and girls, but I think we often miss the girls, and often girls who get DCD diagnosis often have to be worse for people to sort of recognize. Because boys, if they're not sporty, get spotted sooner than girls who are not sporty. So girls sort of get out of sport more easily. Okay, so 60 to 70% of individuals continue to have some but varied challenges into adulthood. And why is that? Well, for some people can find ways around. So I can't handwrite, I can use a computer. I can't drive a car, I use an automatic car, or I won't drive. So we find other ways around it. And when we leave school, we don't have to do all the subjects. We can choose the environment that gives us the most success. So that makes a difference as well. And also there are a small group of individuals have something called benign epilepsy of childhood with centrotemporal spikes. It's nocturnal epilepsy. And there's some children who have motor difficulties with nocturnal epilepsy, and they seem to improve their coordination as they move through puberty. Okay, DCD overlaps with all other neurodivergent traits. So we've got ADHD about 30 to 40% of the time, DCD, autism about 60% of the time, overlaps with dyslexia, overlaps with dyscalculia, often overlaps with developmental language disorder. And we also see higher rates of things, anxiety. There's some evidence of work that even 3 to 4 year olds with DCD are more anxious than their peers without DCD. But we have the long-term impact into adulthood. And it's the later age in adolescence and adult that actually the mental health challenges, because you recognize you're different from your peers, you've got more challenges. And anxiety is a big challenge for people, children and young people and adults. So this is sort of evidence-based. So we've got mental health conditions associated with different neurodivergent conditions, and DCD there, anxiety and depression. I've done some work in that area with colleagues like Elizabeth Hill from England and Maritel Subban from Israel as well, and seeing higher rates of anxiety and depression, particularly in adults. So lots of evidence for DCD plus maths or dyscalculia, DCD plus reading, dyslexia, DCD plus ADHD, DCD with autism. And we see higher rates of DCD in very preterm babies as well. And higher rates in developmental language disorders. 60% of children who have early speech and language difficulties have DCD as well. So you can see our brains don't know about co-occurrence, don't know about the difference between one box and another. And the diagnosis you get is really dependent on the doors you've gone through, it's the specialists you've seen, and depends who you see. So if somebody doesn't know about DCD, earlier this afternoon, I was talking at an international conference with psychiatrists, and many of the psychiatrists have not been trained, don't recognize, or haven't heard very much about DCD. So when somebody comes in to see them and they're thinking about anxiety and depression, they might not be even thinking about DCD on their radar. So that's a challenge we've got. Lack of awareness means that people are not considering or thinking or asking about DCD. So the outcome for somebody with DCD is dependent on their strengths and challenges, and that might be around fine motor, gross motor balance, and some of the other areas. What resources they've got, so what tool adaptations they might have. So if I've got a keyboard rather than having to handwrite, and I'm in a nice quiet environment with a stable chair, my outcome for recording something is going to be really good. Or if I've got good oral skills and I can use speech to text, then I can tell you a story. However, if I don't have those resources, then I might write a very short story, and it might not have complicated words that actually I know about, but I can't write because it's too hard. The outcomes are going to be different. And if the environment is really busy and noisy, it's going to be harder for me, and I'm in a chair that's wobbling and moving around, my outcome's not going to be not so good. So task, individual, environment, really important, has an impact on outcomes. It's really important. Where's the challenge? How can we adapt the task? How can we alter the environment? And we use the term afford success. So what are the P factors? This is presentation, persistence. So how do we predict which children are more likely to have challenges later on? What are protective factors? What's going to help our children to be their best selves? And what are perpetuating factors? So what's presentation? We've got motor, non-motor, and the impact. So motor are difficulties in children with fine motor skills like writing at speed, self-care tasks like dressing, undressing, doing buttons, doing shoelaces, doing bows, wiping your bottom, independent skills, cleaning your teeth. Those sort of things are harder for children with DCD to do. Gross motor skills and balance are kicking, throwing, catching a ball, running fast, running straight, doing more than one thing at once, much harder to do. Something like doing the hurdles, really difficult. Learning to ride a bike, because again, we're doing more than one thing as well. And then what we get is avoidance, because I can recognize that other people can do this better than me. I don't want to be exposed to that. And then we get avoidance as well. So the motor skills, using a knife and fork, writing, these things are harder and more effortful. It means the individual has to think about what they're doing. So there's more cognitive effort as well, balancing as well. So what happens between child and adulthood is your parents help you, but your parents don't go to work with you as an adult. When you go to college or university, usually your parents don't come with you, and the demands go up, but the scaffolding goes down. So say between primary and secondary school, where you're in one class, one teacher, not moving around, in secondary school, you're moving around, you've got to do more things. You're not just doing ball games, you're doing team games. You're not doing writing, you're writing essays. So demands are going up. So often this transition from primary to secondary school is a real challenge for young people with DCD. And if your motor skills are rocky, then that's going to make it even harder. So what facts are important for successful outcomes for adults? Well, selecting the correct goals, going with your strengths. What we know is that people with DCD have often got high levels of empathy, very caring, but high levels of anxiety. And we've got to make sure we protect and people can manage their anxiety, manage their planning and organization. So using your skills, harnessing your talents, and trying to limit the things that make it more challenging for you, optimizing your abilities and compensating for the challenges. So SOC, select, optimize, and compensate. And then autonomy, being able to feel a sense of control. And often when people have done for you, not that you've done yourself, being independent. So often young people with DCD are cognitively mature, but often emotionally less mature because they've had less opportunities to socially engage as well. Being able to have relatedness, connectedness, we are social animals, so connecting to other people, and competence in mastering key skills, and confidence, because often we don't do it because we lack confidence, we don't practice it, so we don't gain competence. So the ability to manage new and varying settings with less support is what we really want. And the predictors of continuation, when if you've got low self-esteem, increased anxiety, bullied in childhood, you've had less social participation, you've got weight gain, low fitness levels, those are the things we've got to, how do we keep that children fit? How do we get them to participate? How do we get them to have social opportunities? Really important. So the motor challenges in adults are things like balance, again, ball skills, hand skills, the things that they were in childhood haven't gone away. Avoidance of team games, so not being fit. And if you're not fit, a lot of individuals talk about fatigue. And this is really important, fatigue in childhood, fatigue in adulthood. So actually getting people to find a sport or occupation that they can gain fitness, not usually a team game, is going to be really important. And then things like learning to drive is going to be challenging as well. Often distance estimation and parking are the two key areas. The non-motor aspects, the executive functioning challenges, managing money, planning ahead, finding things, time management. So we need to start early. If we know these are long-term challenges, we need to help kids with strategies up front. Loss of attention, anxiety, symptoms of depression. So we need to know those are things that are happening in a greater rate with kids with DCD, greater rate with adults with DCD. Then we need to empower young people to manage their mental health, knowing that they may be more vulnerable as they grow up, and finding things that they love and they're good at to raise their self-esteem and confidence. And some children do have associated sensory issues as well. Okay, and they impact reduced levels of physical activity. I don't want to do, I don't practice, I'm less fit. This is really important. And then you have put on weight, higher rates of BMI and rates of obesity, lower flexibility and strength, so I haven't got that core stability, and it has an impact on other metabolic indices as well, and sleep problems. So fatigue, sleep, fatigue, lack of exercise, you start seeing something building up here. And the psychosocial impact, more likely to be isolated, spending leisure time alone. This is work that I did as part of my PhD 11 years ago. But the good news is, in a sort of ironic sort of way, you're less likely to be out clubbing, you're less likely to be out getting into trouble. So it's not good in the same, because you're not risk-taking and you're not doing the things that you need to do in order to become an adult and become more independent. So you have less experience of some of those things. And that's what happens sometimes when people end up going to university. All of a sudden, the stuff that lots of kids did when they were 16, 17, children haven't done, they haven't experienced it, and they're ending up then in a college or university, and they're doing that experimentation then when other people have done that and sort of sorted out who they are. So I did a piece of work with Miri Talsaban a few years ago now. We've looked at, because when I was seeing children and adults, I recognized that they were really caring, really sensitive, lovely. And I wanted to know, is that a characteristic of developmental coordination disorder? And sure as eggs is eggs, yes, we saw in people who had DCD without autism, they had higher rates of emotional quotient. They have high rates of emotional empathy, but lower rates of cognitive empathy. So what does that mean? You feel like, I'm worried about the world, because you can't sort of go, okay, let's put it in proportion, but I can't do something about that. So I think this also drives anxiety as well. So I take it home, I worry about it, I cogitate over it. It's a real problem. So the pathway to diagnosis may not be a straight one. I did a piece of work a few years ago looking at the different trajectories of parents coming into the system thinking their child had DCD. And we plotted all the different pathways. Each one is a parent and where they went and who they saw before they got a diagnosis. And this is just diabolical, really. So this is not good if we don't have systems. The other bit is that for parents, you worry about your kids, you worry about the impact, and having a child where you're trying to navigate a system, get help and support, worry about the next stage, it impacts on your quality of life. And that's exactly what we found out when we looked at quality of life for parents. So what can we do? Support and intervention. I like the ICF as a way of thinking about, a framing to think about what's important. And let's think about always, how do we improve activities and participation? What's going to enable that child or adult to engage in work, engage in education, engage in social life, hobbies that they want to do? How do we find the right environment to do so? So that's really important. We need to think about neurodevelopmental pathways. Lots of parents terribly frustrated, and adults, lack of services or being bounced from one service to another with no synergy, getting one diagnosis, another diagnosis, another diagnosis, and they don't know what they've got, and we're not being person-centered. So that's why this approach is a person-centered approach rather than a label-led. We need to have more transparent pathways. For parents, it's often really challenging to navigate systems, to know where to go, who to talk to, who to trust. And 30 years on, it's still pretty confusing. Some places it's really good, but in lots of places we've got a long way to go. If you're a parent and you're thinking about the ecosystem or where your child or young person is find out what's available, not necessarily to do an hour of therapy, because you're not going to get cured of DCD. What we've got to do is find ways to engage and to help find hobbies that you can engage with and you can enjoy, you can socialize. So it might be a really good swimming teacher that really, or wall climbing, or archery, or martial arts, or cookery. It's finding something that you can engage with, that you can really then, photography, you can start to excel at. So finding out what's in your ecosystem. So the 6 A's are: arm yourself with information. If you're a parent, you're going to have to tell the story again and again. Arm yourself if you're an adult and you've got DCD, because you're going to have to tell your story again and again. Try and put down the areas of what's working, what's not, where are the challenges, what are the things that you're good at. Focus on those strengths, find the aptitude, find the interests. When my son was growing up, he was really interested, he liked dogs. We ended up doing an animal, he did an animal management course. I sort of helped quite a bit really at that point. He's not ended up in that area now as an adult, but at the time it was an area we could focus on and he enjoyed, and that was more important than anything else. Practice. I remember with my kids, I've got 3 kids, I had to tell them and remind them to clean their teeth millions of times before they automated it. So the things you have to do every day, try to automate them, because it's less cognitive effort. So you can clean your teeth and you can think about other things. So the more we do things, putting your clothes out every night, packing your bag on the day before, the more we can automate the things you happen every day, less cognitive effort, allows you to think about and plan the things that you need to do on top of that. I'm still banging the drum about DCD 30 plus years on, because awareness and attitudes of others, because there's still a need to raise awareness. Adapt. Who cares if you can't handwrite? I tap when I pay. I don't really sign now very much my name, hardly ever at all. And I use my computer all the time, and so does my son. He's excellent on computers. Why do we make children do complete pen licenses or pen certificates where they're not allowed to use a fountain pen or a writing pen until they can write properly in pencil? It's archaic And I think it's awful. It really is. Avoid what doesn't need to be done. I'm a great believer in that. You know, lots of people who are adults can't iron, and lots of people don't iron these days. I've got like a top that never needs ironing. So just adapt the things that you don't need to do and avoid those things to make it easier. Success really is 4 elements. I'm going to stop in a second and take questions now. Appropriate practice, sufficient practice, in context, and transferable. So if I'm learning to catch and throw a ball, I need a big ball, a small ball, a light ball. I need to do it standing, sitting. I need to do it on my tummy. I need to do it in different environments, so that if I'm going to play ball somewhere else, I can do it. It's not that I've learned to do catching here, but I can't do it here, and I can't do it with this ball. I can't do it with that ball. So appropriate, sufficient. You'll never learn to do something going to somebody for therapy 1 hour a week. It's not going to work. That's like learning to play the piano and thinking you're going to be a concert pianist one day. Plan for the long haul. Think about 3-year blocks. Seek strengths, as I've said. Focus on fitness. Keep in mind what is really important. I always remember giving a talk many years ago, and a father put his hand up at the end of the talk and said, "I'm really worried that my child can't use a pencil sharpener." I went, really, it's not that important. So sometimes we sweat the small stuff and we really don't need to. Minimize that long-term physical impact. I can't emphasize that as well. Minimize the long-term psychological impact by allowing your child to learn, and you as an adult, look at the things that make you feel good. They can manage and cope with your anxiety, helps you with sleep as well. Really important. And start early with organization, time management. Handwriting's not for life, but socializing is. So finding opportunities to engage may not be in big groups, because not everybody likes parties, but it is about making and sustaining friends and having the opportunity to do so. And I do think we have to allow our children to fall down to get up sometimes. And sometimes we protect them so much because we're worried about that. But actually life is about failing as well as succeeding. Movement Matters is a UK umbrella group where we have resources for people. If you want to find that, go to www.movementmatters.org.uk. If you're a professional, Mac Health, we've got a training course for GPs on this site, which you can go to, which is on developmental coordination disorder. There's things like access to work, and we have a neurodiversity course for educators. So if you have, you're an educator and you want to learn more about DCD, we have a training course for educators on DCD, along with other courses like maths and other courses as well. So come to the site, and I'll stop and I'll start taking some questions then.
So